Alright, so today I'll be starting with an elbow examination. So I'll be going through the palpations of the anterior structures. The first thing we have is the biceps brachii, so you can just palpate along the muscle belly. And then it comes into the cubital fossa right here. You can feel the tendon of the bicep in there. From there, we have the brachioradialis, so if you put them in neutral and resist flexion, you can feel the muscle pop up here, palpate along the belly as well. And then on this side, we have the pronator quadratus. It starts at the medial epicondyle, comes to the middle 2/3 of the radius is where it inserts, somewhere along there. And then we have these tendons at the end of the wrist here, so you can resist flexion. You'll see them all pop up. So you have the palmaris longus in the middle, the flexor carpi ulnaris on the medial side, flexor carpi radialis on the thumb side. Also on the anterior side, we just have the pronator quadratus. So it's just this muscle that runs along this tunnel right here. And then we'll go to the medial structures of the elbow next. So we have the medial epicondyle. You have the ulna. You can palpate the shaft of the ulna on the posterior aspect of the elbow. We also have the UCL on this side. So if you put them in about 50 to 70 degrees of flexion, you can feel the anterior band of the UCL. As you run across it, you will go up and off the ligament. The transverse and posterior bands are kind of harder to feel during palpation. And then that's about all we have for medial structures. On the lateral side, you have the lateral epicondyle. From there you can do the radial head, and as you move their arm you can feel it rotating on the ulna. The anterior ligament runs there as well. We have the lateral RCL over here, and then we have just the RCL running from the medial epicondyle to the radius. We also have on the posterior side, you have the anconeus muscle that runs there. The triceps up in here. If you bend it all the way, you have the olecranon process. You have the olecranon fossa just superior to that. In the olecranon groove is where the ulnar nerve runs, so you can palpate in there for both structures. What else do we have? You can do wrist extensors, all originate on the lateral epicondyle, so you can feel for those. They're kind of hard to distinguish between them, but you can just feel along the muscular belly right there. And I think that's all for palpation. So now we'll move into range of motion. Active range of motion for the elbow. So I will have them bring their elbow towards their chest for flexion, and then going back down is extension. You can have them go as far as they can off the table. Assessing for if they have genu recurvatum, if they go past 0. And then you can have patient position 90 degrees of flexion at their side, and you test pronation by putting their palm down. Test supination by going all the way up. And that is all for the active range of motion for the elbow. The final assessment are some special tests. So I will first be doing the varus special test to test for the RCL. Any pain or laxity would be a positive for this test. You will do it at 0 degrees. So you will stabilize at the distal forearm, apply a varus force at the medial aspect of the elbow, and then you can also perform the test at about 15 to 20 degrees of flexion. doing the same motion. Moving on to the other side of the arm, you can do the valgus stress test of the UCL. Again, same positives is pain and laxity. So you will stabilize distal forearm, apply that valgus force at 0 degrees, 15 to 20 degrees of flexion, applying the same force. And then I will do the hook test for the distal biceps tendon. For this one, you will place them into 90 degrees of shoulder abduction, and then have them flex their elbow, and you can pretty easily hook into that tendon right there. It's a cord-like structure, pretty firm. It's very easy to tell the positive if you don't hook on anything. And then we have the posterolateral instability test. I'll do that last because she would have to move on to the table. The other two I can do from this position. So medial epicondylitis is testing for the wrist flexors. So what you'll do is you'll palpate on that medial epicondyle is where they originate. I will resist wrist flexion. And if there's pain with that, either at where I'm palpating or just in the motion, that's positive for the medial epicondylitis. The exact same test, but on the lateral side, is for lateral epicondylitis. So patient position, they'll just flip over. Flex your fingers for me. I'll palpate on the lateral epicondyle and resist wrist extension. And if there's pain at that lateral epicondyle, it's for lateral epicondylitis. And the final test is the posterolateral instability test. So I'll have the patient hop onto the table for me. I'll demonstrate with this arm. So they'll be lying supine on the table, and you will place them into 90 degrees of shoulder flexion, 90 degrees of elbow flexion, and their arm is supinated. At this point, I will grasp the forearm to apply the valgus stress here, while I'm at the same time applying an axial force down and rotating into pronation, bringing the arm into extension, and doing the same thing on the way back. Positive for this would be their elbow would subluxate, which is pretty dangerous, so it's a very uncommon test to do. You want to try to find this during the history exam, but so that's a positive for that. And I think that's about all.